Britain is moving to the second stage in its battle against the coronavirus, from containment to what it calls a delay phase. So what this means is that people could face restrictions in their movements.
The announcement was made by the Chief Medical Officer, with the total infections now at 90. Almost all the new cases have either recently returned from affected countries or had contact with people who did.
Well, it's not immediately known, though, how 3 new cases in England caught the virus. Earlier this week, Prime Minister Boris Johnson tried to reassure the public, saying that the overwhelming majority of people who contract the virus will suffer minimal symptoms and make full recovery. He said the British Army is ready to be deployed if needed.
Our London correspondent Ollie Barrett is standing by with the latest on this. So, Ollie, tell us then more about this next phase of tackling the virus spread, which has been announced.
Well, the move into this delay phase means that all sorts of contingency measures that Boris Johnson and the British government outlined earlier this week can now be considered to try and slow down the spread of COVID-19 in the UK. Now, it doesn't mean that all of those measures will be immediately or even imminently put in place, but it does mean that health officials are starting to treat the outbreak in a slightly different way. So some of those contingencies that might be used at some point during a growing outbreak would be the use of the armed forces in support of the police only investigating the most serious crimes. If they become stretched by the outbreak, potential restrictions on public transport, on large public gatherings, school closures, encouragement of working from home, that type of thing. Now, as I say, some of those measures may never be introduced, and we heard from the Chief Medical Officer in England earlier that, for example, school closures are not currently considered to be a particularly wise avenue to go down, because we have seen with this virus that children don't appear yet to be particularly badly affected, and perhaps school closures would have more of a negative impact on society, on parents, than they would help in terms of restricting the movement of COVID-19. So all of those measures now being considered. Some of them will be implemented at some point. It just means we're into this next phase in terms of the way the outbreak is being treated and what exactly will be done in response.
Ollie, in view of how the outbreak has evolved in the past weeks, how likely will the UK see a community spread of COVID-19?
Well, medical officials now believe that they are starting to see that community transition, and that is why we are moving from the contain to the delay phase. That, in terms of delaying the spread of the outbreak, is partly to try and reduce the pressure that we might see on the UK's National Health Service, for example. England's Chief Medical Officer, Chris Witty, earlier saying that if the outbreak follows the trajectory that health officials predict it will, based on current evidence, that we will probably see 90% of cases happening in the UK over a 9-week period and 50% of them over a 3-week period. So that could potentially mean a huge strain on health services. That is why some health procedures and treatments might end up being delayed so that the NHS can deal with a growing COVID-19 outbreak. And health officials here in the UK do now believe that that is what we are starting to see, community transmission, and that is why we've moved from contain to delay.
All right, thanks for that. Ollie Barrett speaking to us from London.